Welcome back, Living at Your Finest Champions. Thank you for coming back to learn about your health. Now, today we're going to be discussing a well sought out topic, diabetes. We're going to dive into what diabetes is, the different types of diabetes, signs and symptoms of diabetes, how to treat and prevent diabetes. So there's a lot we have to unpack today. But before we get started, I want to especially thank all my subscribers and those that have watched one video or the other. Thank you for watching, and thanks for leaving comments and sharing. It tells me that you're interested in your health, and for those reasons I will definitely do more videos. I answer questions on my YouTube videos, so please send your questions. Any health related questions, I will try my best to answer them. All right, so that means you have to come back. You have to come back and you have to share with friends and family, right? Because sharing is caring. Now, let's take a walk into our Health Exchange chat room and see what questions were submitted about diabetes so that I can dive into it. Diabetes is a disease that affects how the body uses glucose, and glucose, another word, is sugar. Now, we know that sugar is energy to our body, right? Our body needs the glucose to keep it running. So this is what happens. So you eat, take a bite of anything, the glucose forms in the body. So the glucose from the food actually gets into your bloodstream. And when it gets into there, it's like a knock on the door to the pancreas, which is an organ that houses insulin. So it lets out the insulin because it's aware that there's glucose in the bloodstream. And then the insulin is released. And the role of that insulin is to make sure that it helps that glucose that has been released into the bloodstream to get into the blood cells. So your body gets the energy from the cells. So that's how it is. Really straightforward, right? Now, the pancreas, as I mentioned, is what houses the insulin. But what happens for several reasons? There could be a blockage, a blockage, maybe not making enough insulin, or maybe the insulin just not functioning as well as it needs to. So this is where you have excess amount of sugar in the bloodstream, which thickens up the blood and causes a lot of damage that we see. So 34.2 million people have diabetes. Yes, that's about 10.5% of the US population. It's usually said that if you see 3 people sitting down somewhere, 1 in 3 persons will have diabetes. And a lot of people are going undiagnosed. They have no idea. So for the 26.9 people that know they have diabetes, you have 7.3 million people that are walking around and have no idea. Now that is for diabetes. What's about pre-diabetes? 88 million people ages 18 and older have prediabetes, and that means just before diabetes. That's the simple term for prediabetes. Unfortunately, 65 years and older, 24.2% of them also have prediabetes. So what are these two main differences? You've heard of type 1 and type 2. Type 1 has been shown to be younger children. As young as 5, they have insulin insufficiency. So they have pretty much, what I mean by that is that they just don't make the pancreas that makes the insulin, right? Doesn't make enough. It doesn't make enough for it to do the work that I explained. It doesn't. When they eat, there's a lot of sugar in the bloodstream because the pancreas just does not have the insulin to get rid of the sugar. So that's type 1. Now, again, that's seen usually in the younger age. Now, what is type 2? Type 2, it's more for several other reasons. So there could be insulin resistance. So they make good insulin, but it's just not responding well. Maybe because of a high carbohydrate diet, maybe because of a high fat diet, because the fat is like a glue that sticks to the key. So the insulin is the key to the door, and then there's the cholesterol, the fat that's glue so the key can't open to get the sugar into the cells. So that's a visual. So that is why there's a type 2. Now, you saw in the chat room that there was a question. Is it true that children have it? Yes, it could be genetic. Yes, very common. Even type 2 can be genetic as well. So those are the things that we need to be very mindful of. Now, what are some of those signs and symptoms? You already know I mentioned that high sugar in the bloodstream thickens it up. So anywhere blood is in the body, you can imagine the damage that is going on. It damages the vessels, and so that's why part of the question that was asked, why does it affect the eye? Because the vessels in the eyes are damaged with excess sugar. The sugar is not supposed to be in the bloodstream. It's supposed to go into the cell to use as energy. So you have lots of vision problems. They have nerve problems as well. All of those are just not good. Now, you hear a lot of people say, I'm just thirsty. I can't stop drinking. And that's because they're peeing a lot. They're peeing all that excess sugar. I know back in the day, they used to say if you wanted to know if someone had diabetes, just pee on the ground. And if the ants accumulate, that's diabetes. I'm sure you've heard this before. Why are they drinking a lot of water? Because they're peeing a lot. Why are they eating a lot? Because the body's hungry. It doesn't have the glucose that is needed for the cells to function. Now, why do they lose weight? Because some people have asked, I didn't know I had diabetes until I just lost so much weight. That's because the body starts to use the fat and muscle as fuel because it doesn't have the sugar. So that's why they lose weight. Why do they feel tired? Back to the same thing. There's no energy. Energy from the glucose that is in the cells. So those are some of the signs and symptoms. Kidney damage. Again, anywhere the blood flows, if there's too much sugar, for whatever reason, poor eating habits, genetic, it just makes all these complications occur. Now, how can you get this diagnosed, right? Because you don't, like I mentioned, how many people have prediabetes? You want to know. If you have a family history, you need to make sure that your provider is checking your sugar. And this is all done in a form of a blood test. So speak to your provider and make sure you get checked. If you find that you've gained a lot of weight in the last couple of months or years, there's that COVID-19 weight gain, you got to check it. Just make sure, because if you're having all that carbohydrate and there's just insulin is resistant, it's not working the way it should, at some point it is going to make excess sugar accumulate in your bloodstream. Now, I've talked about the signs and symptoms and how to check it. You need to know those symptoms. If you're having those symptoms, you got to check with your doctor. Now, we find that our solution is in the science. We need to trust the science. And medical research has shown that healthy life choices, less carbohydrate, less fat, bad fat, more veggies, dramatically improves even the most severe form of insulin resistance. And I can tell you for a fact, I've had patients that were just eating pastry in the morning and changed that drastically, and they were able to get off their medication because they changed their diet. We need to trust our body to tell us what it needs. When it tells us, we need to take that decision and make those changes. Now, a lot of patients, are on medication. Now, I'm not going to dismiss medication. I prefer that you're not, so that's why we always want to talk about prevention is better than cure. So be mindful of what you're eating, how you're eating it, so that you don't get diabetes. Now, for people that have prediabetes, the numbers that we look at is A1C 5.7 to 6.4. If patients have diabetes, it is an A1C greater than 6.5. So those are your numbers. Empower yourself. Be aware of what those numbers are. So when you go to the doctor and you get that checked, you want to know what your numbers are. You want to see the improvement. Is it going up? Is it getting worse? These are information that you need to be aware of. So creating a new healthy diet is hard. Yes, I know. I'm speaking from experience. However, if you focus on why it matters, then it's easier to make those changes. Because you know that you're doing your body the right favor, right? You have to be strategic about the right nutrition and personal habits. So what are some of those personal habits? Exercise has been shown to help with diabetes because it helps the insulin. You have less resistance. It processes the glucose also properly. You want to exercise. Recommendation is 30 minutes, 5 days a week, but start wherever you are. Just light walk, just moving, not just sitting down, because when you sit, then the glucose even becomes more sluggish. You want to make sure that you eat a healthy, balanced diet. And when I say that, please hear me when I say I'm not advertising for a particular plant-based, which plant-based is good if you can do that. I am not advertising for paleo or keto. I think the best diet is the one that you stick to and the one that is sustainable, not the one that you do today and stop tomorrow. And then you get all discouraged and you don't want to do it again. The best diet, I say, and science has proven it, is making sure that you have a balanced plate. Whenever you sit to eat, your carbohydrate should just be a fist of carbohydrate in your plate, and the other fist is your protein, lean protein, and then double fist for your veggie. Whenever you do this, you're fuller on time. Your carbohydrate doesn't break down to sugar as fast as it does, so you don't have that quick crush. You eat carbohydrate, everything is carbohydrate, your sugar is just going to crash, and then you're going to feel hungry all over again. So making sure that your meals are balanced, that is number one. And it's not even about the exercise. 85, 90% of the time is really what we eat. The exercise is just to complement it. And you can never lose weight on exercise. Now, let me take that back. Not that you can't lose weight on exercise, but that won't be the primary reason. You exercise it because you want your body function to, your body system to work better. That's why. And to build some stamina and strength and the muscles and the joints, all right? I had a question in the chat room that's asked about African foods. I know. I am from Nigeria, so a lot of our foods, pounded yam, amala, all those things that are starchy, it goes back to the same way that I talked about a balanced meal. We really need to make sure that our veggies, we have more veggies, tons of veggies, and our pounded yam, if you have to eat it, I totally discourage it. I've stopped eating pounded yam because I just realized every time I did it, I was just sluggish. You got to know how you feel when you eat. So even if you want to do it every now and then, if you have to, every now and then I encourage alternative ways of eating that are healthier and it wouldn't affect your body. All right? If you're on medications, check it regularly. Have that shared conversation with your provider, with your doctor. Make sure you check your sugar. Make sure you know what your numbers need to be. Fasting or 2 hours after a meal. All these are important information that the doctors are just not hounding you on. It's that way we know how controlled you are. If any complications from any of those medications, talk to your doctor so that they can reevaluate the medications you are. Again, I am all for prevention is better than cure. But if you are watching and you have diabetes already, you just have to know that you can do it. You can do it. A lot of people have reverse diabetes. You just have to start somewhere. It's simple, but not easy. But you have to know why you're doing it. Well, I'm glad that you stayed true to the end. As I always say, knowledge is power, but consistent practice makes perfect. So what are you going to do? I've talked a lot about what those symptoms and signs are. I've talked about what a healthy diet looks like. I've explained how diabetes is, what really happens with diabetes, right? And why it damages pretty much every organ in the body. So what are you going to do? Are you going to pay attention to what you drink, all those sugary drinks? It's not doing your body any good. It tastes good, but it does the body no good. Yeah, so we got to make sure. You got to, be accountable to someone, to yourself. There's several things that you can do. So pick one, all right? I would like to hear from you. Please leave a comment. Let's hear about what you're doing so we can hold each other accountable. We are together on this journey, so let's balance our health with one or more of these tips, right? So that we can become triumphant as champions at living at our finest. Because we know we need it. Yeah? We need it. We deserve it, and most certainly we can achieve it. So I hope you have a fabulous week ahead. It's a brand new week, and I hope that you stay blessed, and I'll see you next time.